Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, we're talking about cannabis. Dr. Johannes Thrul, a substance use researcher, walks us through the sea change of medical and recreational legalization, the current landscape of medical cannabis research, and why it's so difficult to get better data about the risks and benefits. Let's listen. Johannes Thrul, thank you so much for being back on Public Health on Call. How are you?
Good. Thanks for having me.
Sure. So today we are going to talk about cannabis. As of right now, I think some 23 states and the District of Columbia have legal recreational cannabis, and other states have decriminalized it or approved it for medical use. There's a whole spectrum. And here in Maryland, even as of July 1st, anyone over 21 can buy cannabis for recreational use. A friend of mine recently said he did not think he would see this in our lifetime. So what's happening here? Why this sea change? Where did we start? Medical marijuana to recreational? How did this happen?
Yeah, so I think, what we're seeing here is really just one more state that in the momentum has been clear for a few years now. So like Washington and Colorado were the first states to legalize for recreational use back in 2012. And ever since then, you see sort of like one state after the other changing their laws. It's been definitely interesting to see. At a certain point, you kind of see the momentum going in that direction, and then the states just keep going and keep legalizing.
And so, when we were sort of talking about what we would talk about today, one of the things you mentioned is that there's a murkiness between recreational and medicinal cannabis. And so, in some ways, have we seen medicinal cannabis paving the way for recreational in terms of the legalization?
Yeah, I would say for like what changes laws is in a way, people requesting change and social norms changing around cannabis in particular. And so I would say there's been this trajectory of the first states, like first state was California that legalized for medical reasons. And then over time, you just see like a change in social norms. It's pretty clear to see, over time from like the big national surveys that people are becoming more and more in favor of cannabis legalization. And that started with medical and has now continued like into recreational use. And, the quote you just mentioned of this like murky kind of differentiation between medical and recreational cannabis is really, I think a lot of people are using cannabis to self-medicate certain things. Cannabis for a medical reason, it's not like a medication you get prescribed for a very, very narrow like symptom, right? Or a very, very like specific disease. And once you have the medical cannabis prescription, or now with recreational cannabis, you can just go, like anyone can just go if they meet the age criteria and purchase cannabis. And then what they use it for is really all over the place, right? Maybe just because it makes you feel good, or because it helps you deal with certain symptoms, diseases, disorders you have.
So let's talk about that, because you study substance use, and specifically substance use disorder, and you have a good sense of what research is out there about, is cannabis a viable product, to use medicinally? What do you know about that? What research is already existing?
Yeah, so the evidence is mixed, I would say, at this point. There are various reasons for this, in part because there's just not been a lot of funding going into testing cannabis for like, in a rigorous way of like using, the best evidence we get is from randomized trials. So like randomized trials for certain indications. There are certain cannabis medications available that we know, for example, certain indications there's a lot more evidence for than for others. Like, for example, CBD for seizures. Like that was one of the first really like big indications that where cannabis was approved for. THC for certain things like nausea and appetite, right? Like if you have cancer, for example, things like that have like THC has been used for effectively. And then there are certain other indications where the evidence is a lot more mixed, like for example, for pain, right? So pain is one of the main reasons that people report using cannabis for. And when we talk to patients, they say cannabis changed their life. It made, improved their quality of life. It made their life so much better. In the big like studies so far that have been done, it's very much a mixed bag. Like there's some indication from animal models that cannabis might help. When we look at human studies, it's very much a mixed bag, I would say. In part, and I'm just going to throw this out here, which is like one of the main points I want to make when we say cannabis, it in a way it's really a misnomer because cannabis is so many things, right? So we have different cannabinoids, different concentrations of different cannabinoids. So that the main cannabinoids that are being studied are THC and CBD. That's where most of the evidence is available. But then there are like dozens of other minor cannabinoids and terpenes in the products. You have different concentrations of those in different products. And then you also have now in a medical and recreational marketplace, a lot of different routes of administration and different products available, right? So you can smoke, you can vape, you can have edibles, you can have tinctures and topicals, and all of these can have different cannabinoids and different concentrations. And so when you think about how the explosion of like all of the different combinations that you can have there of different products and different routes of administration, it also tells you how complicated it gets to study this in a rigorous way. Because in a way, you would almost need like a randomized trial for every single one of those and then for every single indication. And that makes it very complicated.
So we know that the research about benefits is complicated, as you just said. What do we know about the risks? There is some messaging that marijuana use can lead to harder drug use. There is questions about whether it's physiologically or psychologically addictive. What do we know about these things?
Yeah, so maybe I'll tackle the addictiveness question first. So cannabis use disorder is a legitimate disorder, in the DSM. There are unfortunately a lot of people who develop a problematic use of cannabis. So maybe some people, it's hard to hear from if you're on the more enthusiastic side about cannabis, but there are risks, and we know those exist. For like mental health consequences, the evidence is probably the strongest that if you have a family history of psychosis or schizophrenia, and particularly using like early on during adolescence is probably not the best idea, because we know cannabis can trigger psychotic symptoms, potentially also like longer lasting problems with psychosis and schizophrenia. We know there are a lot of associations there. It's also sometimes a little bit harder to study because you also don't know if people are maybe medicating negative symptoms of schizophrenia early on that wouldn't necessarily show up yet. They wouldn't have a diagnosis yet, but cannabis maybe helps them to deal with negative symptoms and then they develop psychosis. But, in any case, I think the safe thing to say here is to hands off cannabis if you're younger, like as a teenager, and have a family history. That's to the maybe negative consequences addiction. The use of harder drugs, like there is some evidence that like early use, again, there could be something going on with like how the impact of cannabis on the developing brain that then maybe makes other substances later on more reinforcing. So that could just prime you to be at greater risk of using other substances later down the road, or finding then that the use of other substances is more reinforcing. I will say that, one of the benefits as a public health researcher, like when we look at sort of what the public health landscape looks like and the effect of legislation, in this case, legalization, one of the big benefits is taking cannabis out of the underground illegal market, right? So we know that drug laws in general, and this is true for cannabis as well, have been used to criminalize communities of color, minorities. And so taking cannabis out of like that particular space is a great idea, right? So you're taking it out of the illegal market and giving it to legitimate businesses where there is going to be oversight, where there's going to be testing of products, so you know what you're getting. And you reduce the over-policing of minorities. And these products are undergo quality control and are labeled. Those labels so far are a bit variable, right? Like there has been research done by some of our colleagues at Hopkins. Ryan Vandry, for example, in the School of Medicine has done a lot of work on this, that those labels are not always accurate, but at least we're getting there, right? If you're picking up cannabis at the street corner somewhere in the illegal market, you have no idea what's in it.
Yeah. I mean, decriminalization alone is a major win for public health for a lot of reasons. Let's talk a little bit about what we need to know now. So let's say you have infinite funding and you've got blanket IRB approval. What would you want to do to answer a big question in your mind about cannabis?
So on the medical side of things, we know there are certain conditions that are the most like often mentioned conditions that people are using medical cannabis for. And those are, generally speaking, pain, insomnia, anxiety, and PTSD. So those are the conditions that I think most like are warranted of like looking into for now, because people are already using medications, cannabis for those. And so we really need to like improve the evidence base for those, right? So like clinical trials for different cannabis products, looking at pain, anxiety, insomnia, and PTSD, I think are warranted. So I would say that those is the next step. Would make a lot of sense to me. And, one thing is also like now that the states are getting more tax revenue from cannabis sales, what are they doing with that money? Like, where is that money going? Because in a way, if you look at tobacco legislation, for example, certain states have like required that those funds get used for research on those particular issues, right? So to me, like that would be a very good use of the tax revenue that is now coming in. And we know there's, a lot more tax revenue now that Maryland has legalized recreationally compared to what the situation was like before. And so Maryland could really step up here and help provide some of that evidence.
Do you think there's also a push for looking into not just the evidence as to whether or not it's helpful, but looking into those risks that you were talking about before?
Yeah, I mean, a lot of the big studies are already doing that, right? Like, so they have the like large national studies that are done every year or every other year to collect data. And so we have a pretty good sense of the prevalence of cannabis use disorder. And obviously we'll keep tracking that and to see if those prevalence numbers increase, for example, in states that are legalizing early evidence. And, because this is like something that happens over extended periods of time, you wouldn't necessarily expect, we legalize July 1st, and then you see an uptick in cannabis use disorder like a month later. It doesn't work like that. Even just like, an uptick of use happens over time as like the social norms are changing, for example. So the evidence from other states has not demonstrated that we might expect, that out of a sudden, like we see an increase in psychosis or an increase in cannabis use disorder. This happens like slowly over time with a change in social norms and availability, and potentially also with a change in marketing, right? If like there's now a lot more marketing, then you can over time and with increasing use, generally speaking, increasing use of an addictive substance, you will over time see a potential increase in problematic use and then also an increase in use disorder. But this is not something that happens immediately.
So final question for you. So let's say you are of age and you have some symptoms that you're interested in, I guess, trying to see if cannabis is right for you. Is this something you can talk to your doctor about?
Yeah, I think your mileage may vary there with how much your doctor is comfortable, knows about it. So I think it's still, I would say, relatively fringe, and it It will very much depend on who you talk to. But I think it's as providers, professionals, I think everybody needs to learn more and know more about this, because patients are going to ask no matter what.
And that's exactly what you're trying to do. So we're going to continue this conversation with you in the future, because I know this is a big area of research for you. But for now, thank you so much for your time and for helping us understand this new world here.
Absolutely. Thank you so much for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.